Hi, welcome back to your prescription for medication education. My name is Yenmi, and I'm a pharmacist who wants to bring you quality information regarding medications and other health-related topics. Today's topic is going to be about topical dosage forms. Today's objectives are to do a brief review of the skin's anatomy and its relations to topical drug absorption, define the terms topical and transdermal, and do a review of semi-solid formulations. Our skin is the largest organ in our body, which covers about 1.7 meters square in the average male. For topical medications, the two most important layers that play a crucial role in drug delivery are the epidermis and the dermis. The epidermis lacks blood vessels and acts as the main barrier to prevent external substances from penetrating the deeper layers of the skin. The skin surface is acidic compared to inner layers, which have a physiological pH. The change in pH across the different layers aids in preventing microorganisms from penetrating deeper into our skin. The epidermis is made up of 4 to 5 layers depending on its location. The stratum corneum is the most superficial layer and is roughly 10 to 20 micrometers in thickness. The epidermis is a semi-permeable membrane which medications cross via passive diffusion. The rate of diffusion depends on many factors, but some examples include drug concentration, the drug's aqueous solubility, and oil-water partition coefficient. The following layer is the dermis, which contains blood, lymph vessels, nerves, and other structures like hair follicles and sweat glands. Medications are absorbed into the circulation once they reach the dermis. The hypodermis is often referred to as the subcutaneous layer that connects the skin to the fascia surrounding the muscle. It is rich in adipose tissue and contains large blood vessels and lymphatics. Topical medications have 4 common uses. Number 1, they can be used as a barrier or for protection purposes. In this case, no absorption is desired, a great example being sunscreen. Number 2, they're used to treat skin conditions such as fungal infections. Number 3 would be to treat conditions that are below the skin in a localized area such as arthritis of the knee. And number 4 would be to treat conditions in which a systemic effect is desired, such as hormone replacement therapy. Topical medications can use a variety of delivery systems. These are highly technologically advanced methods to distribute medications in our bodies. These systems include drug carriers and stimulus response components of drugs. Drug carriers function as a vehicle for penetration or protection for a medication to reach its intended site of action. Examples include cell-penetrating peptides, microsponges, bacteria, and bacterial derivatives. Stimulus response components of drugs ensure that the medication is released based on a condition. Examples include ligand-mediated drug response elements and pH-responsive drug response elements. The FDA defines the term topical as administration to a particular spot on the outer surface of the body. Topical dosage forms are designed to deliver medication into the skin to treat a dermatological condition. The FDA defines the term transdermal as administration through the dermal layer of the skin to the systemic circulation by diffusion. A transdermal dosage form is designed to deliver the medication through the skin to have a systemic effect. Topical dosage forms can be grouped into 4 categories, which are semi-solids, liquids, solids, and transdermal systems. Semi-solid formulations are not required to be sterile except for medications intended for ophthalmic use. They must still meet USP standards for microbial limits. If necessary, they may contain preservatives such as methylparaben, phenols, or benzoic acid. They must meet USP's minimum fill test, which ensures manufacturers do not underfill a container, and semi-solids are either packaged in jars or in plastic or metal tubes. Ointments are categorized by the type of base, so these can be either an oleaginous base, an absorption base, a water removable base, or a water-soluble base. Oleaginous bases are anhydrous, they're hydrophobic, and they're greasy. They provide an emollient effect that protects the skin. The emollient effect is due to their ability to create a semi-occlusive or occlusive barrier on the skin, which minimizes epidermal water loss. 4 commonly used oleaginous bases are petrolatum, which is a yellowish, semi-solid mixture of hydrocarbons obtained from petroleum. White petrolatum, which is widely recognized as Vaseline, is a purified form of petrolatum that has also been decolorized and deodorized. Yellow ointment and white ointment are created by diluting the appropriate petrolatum formulation with beeswax. Absorption bases can absorb some water, unlike oleaginous bases, and are also used as emollients but are less occlusive. They are either classified as an anhydrous absorption base. These can absorb some aqueous solutions to form a water and oil emulsion. A well-recognized example is Aquaphor. The other classification is the emulsion absorption base, which is already formulated as a water and oil base and also has the ability to absorb more water. The last two types of ointments are water removable bases and water soluble bases. Water removable bases are an oil and water emulsion. These are easy to wash off and are often referred to as water washable bases. They can be further diluted with water. Water soluble bases have no oleaginous components, therefore they are not considered greasy. Because they have no oleaginous contents, they are not suitable as an occlusive option. Polyethylene glycol ointment is the prototypical water-soluble base. I'll take a moment to review polyethylene glycol because this compound seems to be everywhere in pharmaceutical preparations. PEG is a synthetic polymer composed of repeating units of ethylene oxide. It is water-soluble, biocompatible, and inert. The N in the formulation is the number of repeating units of ethylene oxide. This is why its molecular weight has such a wide range. The number next to the PEG gives an average weight of the molecular range. PEGs differ in their physical and chemical properties based on their molecular weight. PEGs are liquids when their molecular weight is less than 1,000. As the weight increases, the compound takes on a more solid form. One of the most common preparations of a PEG is PEG 3350, which is the active ingredient in Miralax. Creams are a subtype of a semi-solid preparation that contain at least one active pharmaceutical ingredient in an emulsion or a water washable base. After a cream has been applied, the water will eventually evaporate, leaving a thin film of its oleaginous components. Creams are much easier to spread than ointments are, and because of the risk of microbial growth due to their water components, they generally contain a preservative. Gels are a semi-solid preparation in which a gelling agent is added to the solution or a colloidal dispersion to provide stiffness. A colloidal dispersion is defined as colloidal dimension particles, which are particles that range in the size from 1 nanometer to 1 micrometer that are distributed in a liquid. Common gelling agents are carboxymethylcellulose, natural gums, and carbomers. When a gel is applied to the skin, the liquid portion evaporates, leaving a thin film of gel-forming matrix on the skin. There are many types of gels, and they can be classified on the basis of solvents that are used, the colloidal phases, the rheological properties, and their physical nature. Some gels can form thixotropes and require the patient to agitate a gel prior to application. Pastes are semi-solid preparations which contain more dispersed solids than ointments, creating a thicker and firmer formulation. They typically contain somewhere between 20 to 50% of solids that are finely dispersed. These solids help create a dry and absorptive environment that is used to draw out and retain moisture from skin, as well as used to absorb secretions. A plaster can either be a solid or a semi-solid adhesive preparation that is spread on a backing material and is designed for prolonged topical application. The plaster applied to the skin can harden and provide a slow and steady release of medication over time. A protective plaster is intended to provide mechanical protection or occlusion. Well-known examples are adhesive bandages from the Band-Aid brand and hydrocolloid dressings from Duoderm. Medicated plasters have a medicated layer spread on the backing material. An example would be corn remover plasters infused with salicylic acid, commonly found in the foot care department at pharmacies. The fingertip unit method is useful because it helps determine how much cream or how much ointment is needed to cover an affected area if the medication does not give recommendations or guidance. The amount of medication that is squeezed from a standard tube nozzle onto the tip of an adult male is approximately half a gram. This method can be used to estimate the day supply of a medication when the number of grams isn't specified by the provider. This chart lists the number of fingertips units that is needed to treat different anatomical sites. Using the chart above, we see that 1 foot requires 1.5 fingertips units. If a doctor calls in a prescription for ketoconazole 2% cream with the instructions to apply to both feet once a day for 14 days, and the instructions are to dispense a sufficient amount, we can estimate how much medication the patient will need. So if 1 foot needs 1.5 fingertip units, we're going to multiply that times 2, which gives us a total of 3 fingertip units per day. So 3 fingertip units per day times 14 days would give us a total of 42 finger total units. And if each fingertip unit is equal to half a gram, that would give us a total of 21. So 42 times half a gram gives us 21 grams. So ketoconazole 2% comes in a 15 gram, a 30 gram, and a 16 gram tube. In this case, we should dispense a 30 gram tube to meet the patient's need. And that was your dose for medication education. I hope you enjoyed today's video. If you learned something, please give me a like and subscribe. It would mean a lot to me. If you have any feedback, I would greatly appreciate it. Thank you and have a great day. The reference slides are to follow.